Hello and welcome to today's presentation from Pondurance, From Reactive to Proactive, Addressing and Preparing for Cybersecurity Incidents. In today's event, we will delve into the existing cybersecurity vulnerabilities within healthcare systems based on research Pondurance commissioned Xtelligent Healthcare to conduct. We will also discuss plans for future investments and explore the significant role of strategic cybersecurity partners in enhancing defense mechanisms. This session aims to provide insights into current security challenges and demonstrate how external expertise can fortify healthcare cybersecurity. I am Kyle Murphy, Vice President of Editorial at Xtelligent and moderator of today's presentation. Before we get into findings and our discussion today, let's introduce our speakers from Pondurance. First up, we have Dustin Hutchinson, Senior Vice President of Services and CISO. Dustin has over 20 years of experience in information security, risk management, and regulatory compliance. Prior to joining Pondurance, Dustin was a risk and compliance professional focusing on HIPAA, PCI, and risk assessments for new technology acquisitions ranging from infrastructure solutions to patient care devices. Dustin is also currently an adjunct professor at Ivy Tech Community College, Sullivan University, and Embry-Riddle Aeronautical University, teaching undergrad and master's level cybersecurity courses. Welcome, Dustin.
Thank you.
With him, we have Johnny Calhoun, Senior Vice President, MDR Operations. Johnny is a seasoned cybersecurity executive with over 20 years of experience. At Pondurance, he leverages his background from SecureWorks, Fish Labs, and Nisos. At SecureWorks, Johnny led the global implementations group, driving the company to a $500 million recurring revenue business and a successful IPO in 2016. As Executive Vice President of Operations at Fish Labs, he established SOCs in multiple locations and scaled key cybersecurity services, leading to the company's acquisition by Health Systems in 2021. At Nisos, Johnny, as COO, transformed professional services into a scalable managed service. He holds a BS in computer science from Coastal Carolina University. Last but not least, we have Will Gazinski, Senior Manager of the Pondurance Incident Response Team, where he's led numerous investigations into ransomware incidents, data theft, extortion, and more. From spending the majority of his career in the aerospace sector, Will is familiar with the unique balance that an organization must achieve to preserve operational mission requirements while maintaining confidence in their security posture. In his previous role as a security analyst, Will led incident response and forensics on some of the most notable cyber events in recent times at NASA's Langley Research Center. Will has a BS in intelligence analysis from James Madison University. With that, let's get on to today's talk, and we'll begin with getting a little bit more in depth about the research itself. So, talking objectives and methodology. So, Xtelligent has a strong history of targeted research in healthcare, built on our editorial focus on connecting with leaders and decision makers who connect the C-suite with the front line. As you can tell from this slide here, the research objectives here with Pondurance were assessing provider reliance on third-party firms for cybersecurity operations, understanding current business priorities and future investment plans across various operations, and identifying gaps and inconsistencies in the cybersecurity posture of healthcare providers. In terms of our survey details, this was North America only. We did have 100 qualified responses. We fielded the survey the first half of May. Survey respondents, director plus IT professionals involved with cybersecurity technology and processes. Organizations tended to have between 500 and 10,000 employees. And as always with our research, it was healthcare only. All right, guys, so let's get into, healthcare complexity. I had a little note here for myself that, complexity and healthcare go together like peanut butter and jelly, but complexity in the context of cybersecurity and healthcare is by no means palatable to most people and most covered entities in the industry. So, looking at the first data point here, there are numerous vendors working in the cybersecurity space in the healthcare world. While this is necessary to achieve certain goals, obviously it creates some headaches on the covered entity, the provider side of things, in terms of managing their business relationships. Obviously, business associate agreements under HIPAA are incredibly valuable and important for securing the business, but each vendor it presents another opportunity, potential threat vector as well. Should that particular cybersecurity component really not, you know, be able to fulfill its obligations or not be able to function correctly. Dustin, I think I'm going to start with you here. What factors do you find, contribute to healthcare providers relying on multiple cybersecurity solution providers in the first place?
Yeah, what's been interesting in healthcare, especially over the last decade and a half, is the reliance on third party vendors and the sprawl from a healthcare system standpoint. So you think back when everything was on prem, and then all of a sudden there's cloud adoption. We've seen some, boomerang effect where things came back, but then that reliance on software as a service, or as they were called back in the day, application service providers, there's no one solution that can protect all of it, especially when you have hundreds, if not thousands, of systems that you're using. So that reliance on additional multiple vendors is necessary to make sure, from a due diligence standpoint, you've got those baseline controls in place. And what's interesting is when you think about defense in depth and the things that healthcare entities should be doing, from proper access controls and multi-factor and any of the other things that we'll dig into, even having this few of vendors, when you think about the number of systems they have, is somewhat surprising. So a lot of times on our consulting practice, we'll go into a healthcare entity and they'll have, like I said, hundreds of systems, and they'll say, we need to have multi-factor, we need to have auditing, we need to have all these things in place. You can't get it with just a handful of vendors because of all that system sprawl.
Very true. All right, let's move on to the next figure and finding. So organizations they claim to be stymied by perceived complexity and resource demand related to new technology. The most significant barriers include complexity of required technology, a reliance on legacy systems, which healthcare has no shortage of, and a lack of awareness or training, which, considering the workforce challenges that are really prevalent across many industries, but healthcare in particular, obviously proves to be a major pain point. Guys, in terms of how does the use of multiple vendors affect the overall security posture of healthcare organizations? What does this complexity actually mean for being able to really operate in today's healthcare world?
I'll just mention, from a consistency standpoint of expectations, it's really hard to have an apples to apples comparison across the board. So when you've got multiple systems that have multiple different configuration settings, multiple different options, back to that whole even auditing, right? Third party vendor system or SaaS is very different from each other, hundreds of times over. So that complexity is throughout, and it's very hard to train an internal IT staff on how to interact with all those various systems. So that complexity, every time you add a new system or a new variable, it gets multiplied.
Yeah, absolutely. And I wanted to kind of chime in too. And I think a lot of the complexity, even though most folks would probably, try to optimize as much as they can for simplicity, a lot of times it's unavoidable, as Dustin has mentioned, because you have varied skill sets that are required that you really need. And so it's hard to build a general IT or IT security staff that really have that array of skill sets, and they're specialists in every one of those areas. Just like in healthcare, where you don't have one doctor that can do everything, right? You got specialists, for your foot, specialists for your brain, specialists for your heart. IT security is the same way. You need those specialists in every area, because the depth of knowledge just continues. The amount of technology that we're using is very broad, but it's also very deep. And so you need folks with that deep domain expertise in a lot of ways. And so sometimes the only way to get that is, again, back to that reliance on vendors. You have to have multiple vendors in order to get enough talent at the table in order to do an adequate job at securing your organization.
And if I could just follow up there, what's the size of these security teams, these cybersecurity teams in these organizations? How much variation is there between hospital, health system one, and another one down the street? Are we really? Is it really an even playing field when it comes to cybersecurity?
Yeah, I mean, the joke is, if you've seen one hospital, you've seen one hospital, right? And so they're all different. And sometimes it's shocking how small the security or even general IT teams really are at large healthcare entities, not just single hospitals, but multiple hospitals with coordinated business offices and labs and hundreds of physician offices, how small that team is. And so the reliance on third-party vendors is high, because keeping that subject matter expertise in-house is really hard.
Yeah, and I'll just throw in that, a lot of the hospitals are designed around the concept that you have to kind of fail open, right? Something can't just shut itself off in the event that something changes. And so when you recognize that an IT team that's typically staffed with making sure the hospital can simply operate, and then present them with the challenge of enforcing security policy and responding appropriately to different events, you can find that you'll have somebody who's effectively having conflicting goals on a day-to-day basis. And so by kind of apportioning certain responsibilities to a vendor for response or monitoring, and then maintaining that individual singular responsibility of uptime for the on-prem IT team, you can kind of see how the relationships can develop over time and how that might foster a more secure and robust environment.
So, guys, another finding from our research was, obviously you've got this complexity, you've got number of vendors. So organizations have identified consolidation as a key current initiative and a priority for the future. It makes sense. I mean, it's happening across healthcare, not just in cybersecurity. Just there's obviously a lot of technology. There are a lot of vendors, and folks are trying to figure out is there a way to simplify their infrastructure and hopefully kind of improve operational efficiency and maybe eliminate some of the fragmentation that tends to characterize a lot of healthcare systems. So organizations are consolidating vendor partnerships to improve efficiency. Currently, 44% of healthcare providers have started this process. Another 46% plan to do so within the next 12 to 24 months. In total, we got 90% are either consolidating vendors or plan to do so. This is very much top of mind for organizations, and we understand the kind of dollars and cents that are behind it. I wanted to ask the group, what are some of the specific risks associated with having some of these complex security protocols due to multiple vendor partnerships? And I'll stop there before I ask a follow up.
Yeah, I think, one thing, and Johnny mentioned it from a simplicity standpoint, is the less you have to manage is the less you have to manage. So if you've got a vendor or a solution that can cover multiple systems and do what you need it to do, that's one less thing to break or one less thing to fail. So that consolidation, just from a pure management standpoint, makes a lot of sense.
Yeah, and I would add to Dustin's thoughts there. I mean, two thoughts really of some of the risk are, getting everyone at the table across multiple vendors aligned, right, to your game plan and your vision and what you're trying to accomplish, which particular risk you're focused on at any given time. I think it's very important that organizations ensure that the vendors are speaking to each other as they need to. They're pulling those vendors together. They're seeking that alignment. Everyone's on the same page. I think that's very important. And also just in general, just that oversight of the vendors, right? Like don't just turn them loose in your environment, and let them go. There needs to be a healthy engage level of ongoing engagement with your vendors, right? Don't just hire someone and sort of, set it and forget it. You need ongoing conversations. If your vendor offers a monthly call or weekly or quarterly, or whatever the case may be, depending on the scenario and the vendor, engage with that vendor, speak to them, look at their metrics, look at their reports, engage with them. If they have a relationship manager or customer service manager, stay in constant contact with them, bring them together, multiple vendors on the same call if you need to. Again, back to that alignment and just oversight can really help with taking some things that are complex and really can't be simplified any further, but bringing everybody to the table and just, again, creating that alignment and partnership.
Yeah, one thing I want to mention that Pondurance does for a lot of clients is a vendor risk management program. So, you always want to make sure your vendor can actually meet your expected security controls before you sign the contract. So a lot of our healthcare clients will have us do these vendor risk assessments prior to implementation. So the idea is that we understand the controls that the specific organization expects and needs, part from a policy standpoint, plus from a HIPAA security perspective. And then we will assess that vendor from a technical and policy standpoint, make sure that that vendor can meet those requirements. And then if not, put that vendor on a remediation track. Because a lot of times the entity still wants this vendor, but they need to make sure that from a contractual standpoint, that the liability and the service level agreements are going to be in place. So having that vendor risk management program is huge, And then also, you're not waiting on an annual basis to do your HIPAA risk assessment or your risk assessment. You've got visibility in anything that's connecting to your network and interacting with any of your data.
What do you guys have some examples of, what can go wrong? If, you're talking about being very proactive in terms of communicating with other vendors, for organizations who have multiple vendors who are not communicating, what's some of the downside risks that can occur as a result?
Yeah, Will's going to have the best stories for this, right? But there's even the national news ones that happen with, the large vendor that not every entity realized they were interacting with, and all of a sudden operations are shut down. So understanding, following the data of, what can go wrong with these, primary vendors that you're dealing with and the vendors that they deal with. We've got a lot of recent evidence from incident standpoints nationwide of some of the bad things. But Will, from an incident response perspective, you've got some great ones.
Yeah, absolutely. I mean, just speaking from my past experience with working with incidents, having multiple vendors that can provide pretty critical resources can often slow incident response down pretty drastically. As an example of one case, we have worked multiple instances where during incident response, we've identified that multiple different identification providers were being used within the same environment, which when you're trying to contextualize the extent of potential impact for an account takeover or unauthorized access to a specific system, you're not able to understand what that account was able to access within a singular unified perspective in certain cases because of those fragmented identification providers. Similarly, and on a different note, during the incident response process, we often run into the fact that multiple organizations have vendors for various jobs that are related to incident response, but that they weren't aware were. A lot of times, a healthcare provider will have a completely separate backup environment with an entirely dedicated vendor who works to provide their backups in the event that something happens and they need to restore them. Well, we found that often in the case where this vendor is getting direction from a systems administrator, they don't really carry with it the context of why we're doing something. And so having one person work with one vendor, and then the security team who is responding be one separate vendor, and then the monitoring security team who has really the full context of the incident, you're talking about playing telephone, details can be missed, things can move slowly, which when you're talking about incident response in the healthcare sector, hours are incredibly important. We're talking about minutes being important in certain cases. And so really it's all about appropriately exchanging, communicating the context of an incident and ensuring that all associated parties are aware of that context and what their role is. And that's something that somebody can do proactively. We work pretty closely with various organizations to run tabletop exercises. And it's often that during those tabletop exercises, certain relationships are identified and explored that they weren't really aware of before. And we've really been able to get people set on the right path to have better conversations with their vendors and have the right procedures and protocols in place ahead of time in the event that an incident happens.
Yeah, Will, you touched on something there I think is extremely important in terms of everyone knowing their role, right? I've seen that many times where, the client thinks that vendor A or vendor B's got something covered. And I really think it's important for every hospital, every organization to really understand to a level of granularity which vendor's covering what, where are your gaps, where are your overlaps, and maybe use something like a RACI model to go through and do that exercise. Maybe that's a good tabletop exercise to just go through and just understand who's owning which of those pieces. So that's a really good point.
Yeah. And honestly, I think that, in the same way that you can think, oh, well, we have multiple vendors, we need to make sure that we have everything documented in order to communicate with these vendors. Recognize that your vendors also have multiple customers, and you might have unique needs from them that other organizations might not, right? So their governance might end somewhere, whereas another customer might ask you to take care of something. And so making sure you have those two-way conversations. It's not just a call and response. It's back and forth about what you can do and who can do what at each time.
That really sets us up, guys, for the next section of content here on responsiveness. So obviously, downtime has many causes. As healthcare becomes more of a target for bad actors, healthcare organizations really need strategies for responding not only efficiently but effectively. Will, to your point in terms of how they communicate. So one of the significant findings from our research were, the number of incidents that were causing significant downtime. They're actually routine. So you see here on the slide, those reporting 1 to 3, 37%, those 4 to 6, 31%, and then 7 to 9, 11% there. 10 or more, obviously, that's rather significant. But I think this really speaks to the nature of healthcare nowadays, not just from a cybersecurity standpoint, but in terms of how business is conducted online, a lot of cloud-based services, a lot of networking issues and things that actually have infrastructure that needs to be in place for all these systems to be, reliable and responsive. So, digging into this, Will, given that 60% of providers experience 4 or more incidents that cause significant downtime in the past year, what do you feel to be the most effective measures organizations can take to reduce the frequency and then the impact?
Well, the frequency is going to be more of a proactive measure, right? It's going to be, entirely focused around what detective and preventive controls you have in place, and the defense in depth model is really there as a framework and just as a way to think about things for a reason. A lot of people will subscribe to, the shiny new toy and think that it's going to solve every problem when in actuality, again, talking about understanding people's roles, a lot of people don't properly contextualize the role that a solution plays in their environment when it comes to what actual effective controls it carries with it. And so from a frequency perspective, what I would recommend is, take a look at your controls that you have deployed and understand that from a downtime perspective and from an incident perspective, you have to, divorce yourself from the idea that everything is entirely an adversarial action, right? And many of your cybersecurity controls that you have to have in place are for just regular run-of-the-mill activities that occur on a day-to-day basis. And so it's more so about, understanding when an incident has happened that requires downtime versus when an incident has happened that requires documentation that's important. And so shifting over into the impact side of the topic, one of the things that I think is really worth noting is this expansion of the interconnectedness between various providers, and really its impact on what recovery is. And so I'm looking at this and I'm thinking, okay, how many organizations have 4 to 6 catastrophic incidents at a time, or in a year? Probably not as many as are represented on this graph. However, people are running into cases where incidents are causing significant downtime. And really what I view that as is just a logical expansion of really where the industry is going when it comes to interconnectedness. Something that I deal with quite often is following an incident, many interconnected parties will ask for some kind of certification that your organization is now clean. And often what that entails is you have to have completed your investigation, and then performed all remediation actions and effectively certified that those were performed before you can reopen connections with other providers. And so what we found is that it's almost not even the impact of an incident that can cause downtime, rather a slow and methodical investigation that has to be performed from the ground up because of potentially a lack of communication from whatever vendors were potentially already in the place already. And so dovetailing that back into the conversation about communication between vendors, you can see how having a cybersecurity vendor who is able to contextualize the risk inherent with a detection or an incident, communicate that to the investigation team, and then that investigation team communicating that to the IT team who's responsible for remediation. If that goes smoothly, the downtime for an incident can be significantly reduced. Whereas if you have multiple disparate teams who aren't communicating clearly, you might have an incident that should have been resolved in a matter of hours go week or more.
Yeah, and something else on the proactive side that I want to mention is even before recovery, organizations need to think about business impact analysis, criticality rating, business continuity with downtime, and disaster recovery, kind of all as one with those vendors. And so if an organization has a disaster recovery plan, but has not done a business impact analysis and criticality rating, nobody knows what the priority to work on is. So it's really important to identify what are the critical systems. And then back to Will's point, what is it connected to or dependent on? And then are those in that same stream from an impact and business continuity perspective? And then also from the vendor risk, if you integrate in a new system, are you analyzing where that fits into the mix also and not waiting to do that? So you're more prepared if you're understanding from that criticality perspective. And I've got to remind everybody, this is not just an IT activity. This is a business activity. And so it's really important that leadership supports this. They make sure that that impact analysis is happening. They've got kind of a clear view of the assets, not workstations and servers, software suites and data within their organization to make sure in the event of an incident, people know what to do next.
Yeah, and I'll just tag on one more thing, which is just that in many cases, an incident and incident response is approached kind of with the sledgehammer. And I think that a lot of that has to do with many times a forensics firm, incident response firm is brought in, or somebody has an engaged provider who they bring in to perform an investigation. But again, that handoff between whatever the provider was in place and that responding firm isn't adequate in accurately identifying the risk, which, to any seasoned DFIR provider is going to mean we have to address every potential risk rather than the specific risk that we're dealing with in this incident, which can really extend the process of response and therefore the downtime following an incident.
Guys, I think figure 4 here really speaks to, I guess, how important or the trends that are going on in cybersecurity right now, that for the first time, at least in my experience, regulatory compliance isn't by far, number one, and with some distance between it, number two, that we're moving towards mean time to detect. These are the key metrics that organizations are looking at in terms of prioritizing their move from responsiveness to trying to be a lot more proactive. Johnny, I think I'll take this one to you. It's, with regulatory compliance, being a top priority for, 61% of respondents here. How can healthcare providers balance the need for strict compliance with some of the flexibility that's needed to respond quickly and effectively to threats?
Yeah, I think again, it's about bringing everybody to the table, right? You've got multiple parties involved. You've got folks that are going to be advocating constantly on the audit side, right, for compliance. We have all these check marks we got to hit, but then you're more on sort of the risk side, security side. Those guys are saying we got these real threats over here we need to deal with right away. So I think it's again about communication, starting with that, bringing everybody to the table, aligning on what are our risks. As Dustin mentioned before, you need a prioritization scheme, right? And we're not only just talking about just assets, right, or just sort of controls. It's controls, it's assets, and it's your users as well, right? All of those things, you have to look at all of those across the board and have a system. Do that impact analysis, right? Look at these things. If this particular asset was to be impacted, what's the outcome of that? If this particular user is impacted, what's the outcome of that? Which users bring more risk to our organization? So I think you really have to take a balanced approach to each one of those and just identify. And again, the key word there is just prioritize. Which thing do we need to address first? We can't do it all. A note I made while these guys were talking a minute ago was that, we'll never have enough time, money, resources, right? Or, to get risk to zero. We all know that, right? And so again, just, hate to repeat myself, but it just comes back to having a system where everyone's aligned and aligning on those priorities. And so planning out to address those priorities first and just have a systematic way of walking through those things kind of in a serialized fashion and executing and just dealing with those as they come.
Okay. And I'll throw one thing in, which is that I'm unfortunately familiar with the side of regulatory compliance people don't want to be part of, which is after a potential incident occurs, answering questions about it to your regulators. And all I can say is just similar to what we talked about with simulating incidents with the tabletop. I'd recommend you familiarize yourself with the various regulations that adhere to you or apply to you, and understand what questions that regulators are likely to ask following an incident. And as Johnny said, you can never bring the risk down to zero. So you almost have to assume that you're going to encounter or run into an incident at one point or another. So ensuring that you are positioned to properly answer those questions in an adequate way can really help you limit your liability and potential impact of an incident from a legal, from a financial, and from a regulatory perspective.
Now, obviously, you got the trifecta of mean time to detect, mean time to respond, mean time to recover up at the top of the list here. Obviously, organizations want to get better at reducing that time. We know that downtime, some of the big recorded cases, we got months, and that's just not sustainable. Hurts business, hurts patients, hurts the whole community when such things happen. What are the strategies that providers can implement to to actually put these things into place, but then use them to start mitigating the risks that are associated with significant downtime? How do you talk to clients about, getting good in these particular areas?
Yeah, I think one of the things on the front end that we do on the cyber advisory side is make sure that we understand, back to that whole critical systems. Where's the most PHI, right? Like, what is going to hurt the worst if something bad happens? And then, because of what Pondurance does from a managed detection and response standpoint, we have visibility into so many clients. It's not just one environment, so we get to see that, those trends and those baselines across, so many different organizations and even outside of healthcare. So understanding what's important to the single client that we're talking to, but then applying all those lessons learned from the population of all of our clients to each one of them individually, and help them understand, like, you've got to help us from a visibility standpoint. We need to know what your environment looks like, because we can apply all these smart rules and approaches to make sure we understand to, limit that dwell time, or make sure that we're improving these metrics across the board to protect patient and human safety whenever possible.
Yeah, well said, Dustin. Some thoughts I had around this as well. And I love your thoughts around the trends, because this is something we do actively in operations all the time. Again, back to that engagement and partnering with your vendors, right? When we have our monthly calls with our clients, or weekly or quarterly, whatever the cadence may be, as we see patterns, we're bringing that into the call, and we're saying, hey, we're seeing, for example, we're seeing a lot of BECs, and here's the pattern that we're seeing. We're seeing a lot of phishing attacks through reverse proxies leading to this, and that's how these guys aren't hacking in; they're logging in, right? They're stealing credentials and logging in. So we share that, and we ask the customers, hey, we know everybody's smart, and you guys are working really hard, but have you enabled multi-factor authentication? Have you enabled conditional access? And just kind of go through those lists and just really make sure. So yeah, absolutely taking lessons learned from one client and leveraging that so that everyone can benefit from the group's learning. So great point, Dustin. And I wanted to mention on the meantime to detect, we mentioned that briefly. I think tuning is paramount. And again, back to just that engagement with your vendor, the more time you spend with your vendor, partnering, talking, having a conversation, just don't expect that your vendor is going to do everything perfectly out of the box. That vendor does not exist. I've worked for many of these, so has Dustin, so has Will. We've all been there. We've seen a lot, right? And the multi-decades of experience we have combined here. Nobody's perfect. And if they claim to be perfect, you need to be asking a lot of questions. The best effectiveness you're going to get in a detection strategy is to partner early and often with your security vendor. So from day one, soon after implementation, you should be, hey, let's partner, let's run some tests. I want to make sure that everything that I thought you implemented is actually, you've got vision on those things. Let's run a few tests, make sure we've got vision north, south, east, and west, right? But let's also make sure we've got all, that our GPO policies got all the event IDs turned on that need to be turned on across all of our critical assets. Do we know where all of the critical assets are in your organization? Do we know the names of those servers, those types of things? So it takes a lot actually of partnership to build an effective detection strategy for a client. And you have to invest time in that. The more time you invest, the more dialogue you have, the better it's going to be. Our clients that have the fastest detection rates and the highest coverage in terms of detecting threats early and often are the ones who partner with us the most. And so we've just seen that as just a recipe for a massive amount of success in reducing those detection times. We've made a lot of investments in automating, bubbling up those threats that we see time and time again, learning from one client, seeing that pattern, automating that so that those threats bubble up to the top of our list, and we can do those things within minutes versus hours of detection time, and certainly not days. So that's automation is a key element in that as well.
I think just when it comes to the relationship between a security provider and just organization in general, can't tell you how much, how important it is for someone to recognize where you are deficient, right? So to Johnny's point and to Dustin's point, understanding the organization and understanding best practices isn't always everything that you need. There are some cases, and hospitals and healthcare are a great opportunity to explore this, where you are potentially reliant on legacy operating systems, legacy software. There, you can't apply what the industry says here is the number one best practice. And so in working with your cybersecurity vendor, that's a really great opportunity for you to explore, okay, what are some alternate means through which we can make sure that this is secure? How do we get to the same end through a different means because of our unique situation?
I was just going to echo what you guys were saying in terms of the importance of asking questions externally and internally. It seems to be, from my experience working in healthcare, the organizations that are most skeptical tend to be those who are doing their due diligence most. And perhaps it causes some headaches because it's a lot of awkward, uncomfortable questions, but you really you gotta check all the boxes, particularly here. Assumptions we all know assumptions will do. So.
Yeah, well said. Absolutely.
All right, and speaking of compliance assessment and working with partners, um, a major component of this research is really the reliance that healthcare organizations, covered entities have in terms of their vendor partnerships to not only to implement the technology, but there's a huge component in terms of assessment and auditing. You only know what you know within your four walls, so bringing in an outside expert really makes clear some of those deficiencies, that Will was talking about. So one of the findings we had here on Figure 5 was, technology training consolidation initiatives. They all still come second to HIPAA compliance, and we all know that HIPAA compliance is a moving target. It's not overly prescriptive, but there is definitely things you should be doing. And as we'll see in a future slide, there are some organizations that are definitely going over the top to make sure they're doing everything they can do within their power to stay compliant, stay ahead of the curve. Some of the other key goals beyond compliance, we've got securing new systems, consolidating cybersecurity vendors, like we said at the top, protecting, Internet of Medical Things. We've got more connected devices than ever before in healthcare, and that's a trend that's unlikely to change. And all these together pose growing threats to just really an expanding attack surface, which no one in healthcare probably wants to hear that, but each new device is an opportunity, I would imagine. So guys, kind of question here was really, with the 71%, the 3 and 4 organizations prioritizing HIPAA compliance, what are the specific steps that they should take to ensure that they're meeting these regulations effectively? But I say also, I would probably add to that, but also keeping pace with trends in terms of, CISA reports and things like that about what these new threats are. Compliance in some ways is static, but there's new and emerging threats that are out there. So I don't know who wants to kick us off.
Yeah, I will if you don't mind. So, I mean, we always joke, compliance is what you have to do. Security is what you should do. And, HIPAA's been around for more than 20 years. It hasn't changed much at all. You got your administrative, technical, and your physical. But how it applies to the technology and how it's evolved is what's been most difficult for organizations. So, like I mentioned earlier, the vendor sprawl and the transition from on-prem to the cloud and back, and then back to the cloud again, that's made compliance very, very difficult. So having established policies and procedures that speak back to the controls that are required from a HIPAA privacy and security standpoint, but based on a best practice framework is what we recommend. So we like to take our clients down the path of following this 800-53 from an actual control standpoint, pivot to the HIPAA security and privacy perspective, and then don't just think about policies and procedures. Think about that actual maturity model. So policy, procedure, implementation, testing, and integration, right? And then know where the appropriate spot to land is based on that criticality of any system. So you've got to follow the data, whether it's in your own house or a third-party vendor, And so from the covered entity to the business associate, and it's not a one-time thing. So back to that whole cycle of how do you evaluate risk, and then do you have a risk tolerance practice also? So, it's again not an IT problem; it's a business problem. But you have to rely on IT to help understand from an exposure management, not just a vulnerability management, the likelihood of occurrence from a risk standpoint. So when you use an organization like Pondurance, so not just cyber advisory for the risk assessment, not just digital forensics incident response, but also that managed detection response or MDR provider, you get more of a holistic look at your entire organization. And so even though we may not be the one-stop shop for all security and compliance, at least having that perspective to look at it, take a step back holistically and say, this makes sense from a practice standpoint to meet HIPAA compliance to help ensure the security of your patient data. I think is the path that we try to take our clients on, to help them build a program that they can maintain and sustain over time. And we kind of come in and do a lot of the heavy lifting, but then know when we can hand it off to the organization to where they're not 100% reliant on a vendor all the time.
Kind of follow-up question to that. We, here in this particular slide, we talk about securing new systems and then training employees on cybersecurity. Guys, what's the proper balance for introducing new technology, but then training the staff? Because we know both can be a weak point if not properly addressed from a cybersecurity standpoint.
Yeah, so if you don't mind, I'll go again. I think training is huge, but there's got to be balance. And it's one of those where you need to have your HIPAA compliance training, you need to have your annual security awareness training. They need to understand expectations from a policy and procedure standpoint. They need to understand, your employees need to understand emerging threats. So business email compromise and phishing is huge right now. But you can get to the point where you are practice phishing your employees so much that the effectiveness drives to nothing. And so training's super important, but you've got to find that balance to where you've got, the testing outcomes versus the real life outcomes. And then you've got to have the technical controls in place to know when the human fails, can you at least respond to it appropriately? So that's my take from the compliance and consulting side.
Yeah, I like your take there, Dustin. I think one other thing I'd maybe add to that is, we talked before about systems, right? And having that, a way to prioritize those things. One thing that I would love to see more, across the industry, is again going from not just training, but taking the data that you get from that training and doing something about it. So oftentimes we'll see, okay, we've tested these users, right? Now we know who our most frequent clickers are on the fish scan or the fish testing, right? So we know who these folks are. No matter what we do, how many times we train them, how many courses we put them through or remediation training, they're going to click on every link that comes through their inbox, right? And so every organization has those folks. They're our risky users that we got to deal with. But a lot of times, we're just putting them through more training, but we need to do other things, right? We need to go back to conditional access. We need to go back to locking them out of things. Like maybe there's just some level of freedom those users don't have, because these are the folks that are creating substantial risk for your organization. These are the folks that the bad guys are getting to. They're getting in, they're logging in and pivoting around, hitting your domain controller, right? And a lot of other bad things are happening after that, very soon after that. And guys, this doesn't happen over days, by the way. We do see lag time where, bad guys been on site for days and we just discovered it, or months even sometimes. But a lot of times we see a massive amount of damage happen literally within minutes or a few hours. So it's prevention. We need to spend a lot more time on prevention. And again, taking these risky users, and we got to put them in a box. We got to do more around that than what we've been doing in the past. So I'd love to see folks doing more with that data, because we do have good training now. We've got good data that we didn't have years ago. We got to do something with that data.
Yeah. And I'll just tack on one more thing, which is really just going back to what I said earlier about people assuming that a lot of incidents are adversarial. We run into a lot of cases where somebody's security or, architecture has really been designed to prevent an adversary from getting in from the outside. But, in many cases, we see incidents begun by somebody just being an unwitting insider. They allow somebody in, they click the wrong link, And so from that perspective, somebody who's really looking to engineer their environment to be a high reliability environment to stay up as long as possible, you want to, as Johnny said, put them in as small of a box as possible and employ those principles of least privilege as much as possible within your organization, because much in the same way you'd like to minimize the impact of some external adversary getting into your environment, I also think that you should try to minimize the impact of one of your risky users doing something that they shouldn't have because they were otherwise predisposed, potentially providing healthcare to a patient or something like that.
Yeah, well said. And I think the data has shown it many times through many studies, the Verizon study recently as well, that it's not the bad guys, it's not the nation state actors that you got to be worried about them, but you also got to be worried about your internal users by a factor of 100x more. I think because that's where we're seeing the volume of clients and just breaches, just generally speaking, that's where we're seeing a lot of the volume insider threat or compromised insider.
It's a good shift, guys, into just one of the things that we found in the survey where, external more than internal factors are driving organizations to increase their spending on managed service providers. So, a lot of this is including managed detection and response, incident response, risk assessments. They often arise in response to external events. And then providers are likely to increase MSP spending if there are changes to HIPAA, because we understand the importance of compliance. If there's new cyber or ransomware threats that are emerging, or the number of attempted or successful attacks increases. So the question I had for the group here was, given changes to HIPAA, which they've been incremental, but they have occurred over time, and then the emergence of new cyber threats, particular ransomware, the malware, which has really jumped in terms of prevalence. How do you see these factors driving folks to really look at managed service providers and their investments there? How is that changing, perhaps?
Yeah, I think from the ability to transfer risk to a third party, that's appealing, right? But then also needing to train and staff and keep your own security operations center is almost impossible for organizations. So having a vendor that has that staff, has that expertise, doesn't have that turnover that you have to deal with is a huge win, and it's cost effective. So not only do you get a better product, but you get it at a better price than what you could do in your own house. I think organizations are seeing that more and more, and then also seeing, especially with Pondurance, from the managed detection response plus everything else that we do. It's I always joke around, like, you hire Pondurance, you get a group of people, but it's also backed by the power of Pondurance. So we've got this bench of incredible talent that just knows a lot of different things and understands especially healthcare, and then all of these things from a cybersecurity and general IT standpoint. It's really hard for organizations to try to build that in their own house.
Yeah, absolutely. And I think the skills gap is enormous, especially when we're talking about changing compliance or new emerging threats, right? Like, it's a moving target. And so having a vendor that is focused and specialized in those areas, they're going to be able to be more nimble, pivot to those areas as needed, shift their resources. They're going to have specialists in those particular areas that can ramp up on those emerging threats a bit faster. If you're trying to build all of that yourself, you may find yourself in a position to go out and you have to hire an additional team member to do that. So now you got to go through the budgeting process to get, to secure the funding for a new hire. You got to go start recruiting. You got to bring them in and hope that you made a great hire and that's not something you have to deal with down the road. Right. So, so using a vendor really can help because they have, like, for us, we're always putting into our hiring strategy, our training strategy. We're trying to look for those new threats that are coming, those new compliance changes that are maybe coming 6 months down the road. We're looking at those things that are being discussed before they're even real, and we're pivoting on those things and making those changes so we're not surprised. So yeah, absolutely. Skills gap for me was just a big one of those, and just getting ahead of that.
Yeah, and only thing that I'd tack on there is just on top of the skills gap that some people may find they run into if they try to develop an internal security operations center, you're also just lacking the exposure that a more distributed organization gets. To the point of that graphic where it says, hey, one of the big things that we're always considering is the rise of new types of attacks. What are these new types of tactics, techniques, and procedures? If you're a SOC that's only monitoring your organization, it's very unlikely you're going to get hands-on experience with those. Whereas if you're a SOC or IR team who's handling hundreds of clients and hundreds of incidents and sees every type of incident under the sun, you're much more likely to be able to apply the lessons from one previous incident to response and detection for another one for a different client. And so effectively, you're kind of putting yourself into a pool of shared knowledge that you otherwise would be kind of outside of if you were to stay in-house.
Guys, just going to breeze over the next couple of slides here, but just speaking to the point, the fact that, in terms of the historical approach to HIPAA assessments being on, an annual basis for most organizations, you've got a pretty sizable chunk nowadays who are doing these now on a much more consistent basis. I think their understanding, the inference could be just their understanding, that vigilance really does come from doing your due diligence, and it's been something that we've been seeing, at least for organizations that tend to be on the leading edge. And then here on Figure 7, just, auditors and procedures are more important than training for HIPAA compliance. A lot of engagement with third parties to complete these activities. And I'm curious, in speaking with you guys, given that third-party consultants kind of supersede internal teams for HIPAA compliance assessments and other assessments, what do you see as the chief, advantages of going outside the organization versus staying within?
Yeah, so that exposure to other best practices in other organizations. So a third-party consultant does not have the same internal proximity blindness that an internal resource would. And so having that external set of eyes to identify, what's good and what's bad about the program, usually carries a lot more weight with leadership and the board. So I think a lot of IT teams and cybersecurity teams that are internal recognize the value of that third party auditor, not only from a finding standpoint and the recommendations, but also verification and validation of their program overall. And I think a lot of times also the speed that a third party consultant can actually get the assessment done and not be taking away from whatever the person's internal job is a huge deal. And so that's why a lot of times, like, even though HIPAA doesn't say thou shalt use a third party, a lot of times organizations bring us in just for those same very reasons.
Yep, well said, Dustin. A couple thoughts I had jotted down here was, consultants also are not as long-term time bound, right? So if you need a quick project done, it is kind of a point in time project. We need to get it done over the next 90 days. You can bring the consultants in, and sometimes maybe it's multiple consultants or a whole team or a vendor to come in and do that short-term project, knock out the work that needs to be done. And again, like you said, Dustin, don't interrupt the current roadmap that your company's on, or that your IT roadmap may, maybe it wasn't on there by design or something. And so you bring in those consultants, they can come in as sort of your hired mercenaries, hired guns to come in and just sort of take care of something and get it across the finish line for you. So then you can also shift that to different skill sets, right? Whereas if you try to hire for this internally, you end up hiring a set of generalists. The technology is not as deep as it may need to be. So you can really go out and, again, sort of get those hired guns with that deep technical expertise for that short time period, that time box window that you need, get that project across the finish line, shift to the next project next quarter, next project next quarter, and you can really turn things around or make the improvements that you need to make by leveraging those consultants.
Yeah, and the funny thing is, it's the remediation that's more important than the assessment, right? So you identify those issues, getting those things addressed is the most important piece of the puzzle. And so what Pondurance does, we've got a platform or a tool that's called My Cyber Scorecard. A lot of our clients that are healthcare clients use this, back to the whole based on a best practice framework, NIST 800-53. You do this really robust risk assessment, apply it to the HIPAA security and privacy requirements, but then look at that granular kind of nuanced look at the systems. Most healthcare entities are not assessing enough of their environment to meet the HIPAA requirements. And so what we try to do is set a program up to where we say, look, You need to look at your entire organization. It's not just your EMR, it's not just your PAC system. You need to look at everything. And so, how can you do that in a time effective, cost efficient way? We've got a method to do it. And we've also got, like I said, from the vendor risk standpoint, a way to integrate those new systems into the cycle to where it's not a surprise 11 months after implementation for that new risk assessment. And so I think, again, that the value of the tool set and that perspective and experience that a third party brings in is huge.
All right, so now on to future plans. So identifying and plugging gaps in an organization's cybersecurity posture will require strategic investment moving forward. And respondents made clear, where they think they're most interested in investing in, or in terms of shoring up any particular deficiencies they have. So, guys, we got a few slides here that I'm not going to kind of bore everybody with the particular details, but as we can see here, risk assessment, security analytics, incident response, managed detection and response, we've covered them early on in terms of the capabilities that organizations want to have in place. But my question is, how do they go about getting started? What are the next steps? Obviously, you want to engage the vendor community, but I wonder internally, what kind of questions should they be asking themselves? And then how do they make those connections with potential partners?
I think from the risk assessment being at the top there is interesting, where compliance assessments is lower down the list, right? So, like, your risk assessment that you need to do from a healthcare standpoint shouldn't only be compliance focused, right? It's not a gap assessment; it's a risk assessment. So organizations need to make sure that that is the path that they're actually following. Do they understand from a risk standpoint, based on the current threat landscape, not the HIPAA controls, but the current threat landscape of the likelihood of occurrence of something bad happening within their organization, and not just at their systems that house PHI, but anything that can be used to pivot into their environment. So getting better at that from a technical and you know administrative standpoint, I think is a big deal. So really focusing on understanding what is in the environment. So from the asset inventory standpoint, again, not just servers and workstations, but everything. What is in the environment? And do we understand the threat landscape currently, and all the things that could happen to these systems? And then back to that whole what is important from the prioritization and criticality standpoint, I think is the best first step for organizations to get better at that aspect of this.
Yeah, I think my thoughts on this is, guys, we live in a sort of a information overload, data rich environment, right? We have more data than we've ever had in cybersecurity, right? We've got all the assessments that we're doing, not only just our auditors coming in doing assessment on controls or compliance, but you've got your vulnerability assessments, your risk assessments. We have so much data, so many dashboards, so many tools. It's just information overload. And I know most CISOs struggle with this, and they have that problem. And so I think some thoughts for me on this is, one, take a deep breath first, right? Because you're not alone. We're all dealing with it, okay? Every single day, you're not alone. So, go out, talk to some folks, make some friends, whatever you need to do there. But I think the next step, is find that good, trusted cybersecurity partner. Don't go with the lowest cost solution. Don't go with the highest cost solution, right? But find that partner that has good people, that they will tell you the hard truth. They will have those hard conversations like we talked about before. Sometimes there's uncomfortable conversations that we need to have. Sometimes it's, hey, Mr. Customer, I'm seeing this in your environment, or hey, you guys aren't following up on this. You really need to do that. You got to have a vendor that will not just be all smiles all the time, but tell you the truth. Also have a vendor that's willing to admit their mistakes if they make a mistake. Are they willing to admit when they're wrong, and will they pivot, and will they fix it for you? Right. So look at the character of the vendors that you're hiring. Hire good people. Right. I would just say, again, it comes back to, we've got to execute. Just having the data alone is not enough. Just signing up the vendors is not enough. Just having the tools and technology is not enough. You have to actually move the needle in your business, move the needle in your security program, and actually protect your assets, protect your users, and protect your business. You got to do that by identifying those risks, as we've talked about as the theme throughout this. But again, it gets back to prioritize those highest priority risks. Make sure you got a tool and a good people to do that, and you got to execute. Are you tracking execution against those needle movers? That'd be my thoughts on this. Thank you for the opportunity.
And then, Will, we just close things out here. Obviously, highlight the importance of responsiveness, but I'm curious about your thoughts and turning that responsiveness into just being a lot more proactive at detecting and getting further upstream, hopefully mitigating the downstream impact that a particular incident, adversarial or otherwise, could actually have on the organization.
Yeah, I mean, I always kind of liken a lot of our forensic investigations as kind of going to the dentist, where a lot of people don't like going to the dentist because you're going to be confronted with everything that you've been doing for the past year or whatever, right? I always recommend, and I think that it's generally one of the most impactful things that one can do for their own understanding of their security posture. I recommend people kind of put themselves in to the worst case scenario and then understand what is going to happen and then work backwards from there. We talk about mean time to detect. We talk about, understanding the risk, the actual landscape, not just what HIPAA and not just what NIST says your security controls should be, because of situations that we find with a lot of the clients that we work with. A lot of them are postured on paper to be fully prepared for the incidents we run into. But the unfortunate thing is, the nature of incidents in the landscape as a whole is constantly changing. I mean, it's changing from day to day. It's changing from hour to hour as signatures are updated and shifts change and all that, all kind of feeds into the potential for a new type of attack or some effective worst case scenario to occur. And I think that when you put yourself in the shoes of somebody who is, okay, rather than plan from the top to the bottom, let's employ some counterfactual reasoning and just understand what things would get us to worst case scenario and then address those factors, moving backwards. I think that is really a good way to think about, okay, what are the possibilities that, are out there as far as what the threats are, and then where along this, incident attack chain would be the most effective way for us to introduce a new solution, a new control, a new policy, and things like that.
Well, that concludes today's presentation. A special thanks to our speakers, Dustin, Johnny, and Will, our audience, and our sponsor, Pondurance. If you would like to learn more about the study or speak to any of the Pondurance presenters today, go to pondurance.com for more information and contact information.